Good morning, Kuya!
Mga kasambahay, usapang pangkalusugan na at ngayong araw kasama pa natin ang ating chiropractor. Walang iba kundi si Dr. Rob Walcher.
Yes!
Good morning!
Welcome, Doc.
Good morning. Doc Rob,
Hi there,
please greet
everybody.
our viewers this morning.
It's Happy Women's Month. Hello,
Yes.
everyone. I'm
Women's
excited to be
Month.
here. Let's
All
talk
right.
about women's health.
Oh, yeah.
Yeah, specifically, Doc, for our women viewers, what are the important factors that chiropractic care can address for women?
Oh, well, chiropractic care can do so many things. Women, obviously they deal with different things than men. Pregnancy, for one thing. A lot of people want to know, can chiropractic help pregnancy? And yeah, it helps in so many ways. Oftentimes, a woman, as they're going through the pregnancy, has back pain, they have pain in their leg because of that increase in their weight, and then the anterior weight distribution creates stress on the spine and causes pain in the leg. So chiropractic can still be done even while pregnant. We just maneuver the body so we're not even touching the abdomen. And so we can just gently adjust one spine and we alleviate that stress on the nerve that's causing the pain. And so chiro is great for pregnancy, but it's also great for the delivery.
Okay.
Because oftentimes, when we're pregnant, again, so our pelvis is our spine is not moving properly, and so it affects the delivery, it affects the dilation of the pelvis, so it disrupts the birthing process. So oftentimes will lead to a C-section, so surgery. So by getting regular adjustments, by keeping the pelvis moving and in a proper alignment, it actually speeds up the delivery process because the pelvis dilates and it lessens the chances of C-section. So that's the second amazing thing. It's also great for the embryo, the growing fetus, because again, when we adjust one spine, it's all about reducing the stress on the nerve. So we improve that communication to the uterus. So we improve the function to the growing baby. So
Doc, is it safe for any month of pregnancy to undergo chiropractic care?
Yeah, we take all the way up to so even when they're quite big. So yeah, when you'll see oftentimes a person will be dapat, they're always face down. However, while pregnant, of course, once it gets big, then they're just always tihaya. Face up, and then we go tagilid when we do the lower spine. So we're very gentle, just a little bit of pressure on the spine, again, alleviates that pressure.
Talking about childbirth, Doc.
Yeah.
After childbirth, how early can a woman have or try chiropractic care?
Yeah, right away. I mean, of course, if they have to have a C-section, if they have to have surgery, maybe there's a little bit of downtime. But, it's chiropractic is not a violent thing. It's not like we are twisting and breaking things. It's very gentle, so done properly. That's why it is important to go to a real trained chiropractor, but it can be done right away.
Right. Doc, how about menstruation and hormonal balance for women? Does it have a factor that helps with women with chiropractic care?
Yeah, so menstruation, it's quite common for a female to have, cramping, feeling
PMS.
lethargic, PMS, and etc. So again, when chiropractic is not just about cracking your back to get a popping sound like it's now kind of become popular for. Chiropractic is all about improving that nerve, right? So every single vertebra, every vertebra in our spine, there's a nerve that exits, that communicates to organs. So that's how we can help with hormones, we can help with the communication to the uterus, so we can help with painful menses, cramping, PMS, we help with those things by just, again, gently removing that pressure on the nerve, improving that function, so yes.
But Doc, generally, what are the most common conditions that you treat in your clinic for women, especially?
For women, well, most people, come in and see us because they have back pain, right? So most people think, oh yeah, back pain, you go to the chiropractor. So back pain, of course, is number one, and we all at some point in our life experience back pain, right? Because the causes of back pain it's all because of just daily living. If you're seated all day, or if you're a laborer picking up heavy objects, or and sleeping in strange positions. We sleep on our side, we sleep on our stomach, we bring our leg up. So it's these things that we're doing every day. We all are doing them. They're called stressors, right? We all have these types of stressors, physical, emotional, and chemical. And so people come in because they have back pain. But also, again, we have headaches. People sometimes get numbness, tingling in their arms, or they have sciatica, they have pain in their leg. These are all chiropractic conditions. Yeah.
Doc, let's talk about scoliosis because I know a couple of women that I know most of them have scoliosis or slight
Yeah, it's quite
bend in their spine. Is it more common in women?
It's for some reason it is. I don't know if they have any type of reason why. However, it is quite predominant in
Common in
females, and I
women,
take care of a lot of people with scoliosis. 10 years old, 11, 12, 13. The younger you start caring for a scoliosis, the better. Because after 18, your spine is really kind of positioned in that state. So the younger you come in, the more chance we can improve it. Now, you never can promise to correct a scoliosis because that doesn't exist. Anyone that's promising that's not accurate. So so we can deliver these gentle adjustments on children, and we can improve things over time.
So how long is the treatment for our patients with scoliosis?
Well, the longer you do it, the more we're going to change it.
Okay.
So I tell people, I'm very upfront, if you really want to make a significant change, you have to think about this for 1 year, 2 years, 3 years.
Okay.
I mean, it's just like braces on the
Regular,
teeth. How long do you wear braces on the teeth, especially here in the Philippines? 5+ years. We can improve it, and it's like that with everybody that comes in, whether they're 40 years old or 12. The longer I can see you, the more I can change things, whether it's scoliosis or the posture, bringing the shoulders back, bringing the head back. That takes time.
Speaking of the time frame, Doc, what age should our viewers go to our chiropractor to have our spine checked?
That's
How
a good
early?
question. Really, the younger you do it, the better, because as we age, the spine is more solidified and it's harder to change it. So most people do come in, they're already 30 years old plus. So that's why at the beginning we usually need to see them a couple times a week in order to change the present condition. But then once we get it all fixed, then we do like a maintenance of once a month. So to answer your question, we do have children that come in. Now, usually, of course, if a child is coming in, they're presenting some type of an issue. Maybe they're not sleeping through the night, or they're not going to the bathroom regularly, or they're getting chronic ear infections, or they have autism, or they have tics, they have some type of ADHD. These are all, signs of stress on their nervous system. And so some people don't want to just go the medical route and give a medication. So chiropractic, again, is that alternative. We don't do medication. Our goal is to prevent medication. So we deliver these adjustments to improve the function of the body naturally. So we help with the ear infection. We help with the regular bathroom. We help with the crying or the colic. So we can help with this even as children. It's very safe.
But Doc, I've read somewhere online for women who are active in sports that women are most likely to tear their ACL more than men. Is that true, Doc?
No, I've never heard that. But I mean, maybe if you've heard that, possibly it's true. However, I mean, you see in sports, athletes always are tearing their ACL.
How does chiropractic care help with women who are active in sports, Doc?
Okay, so we have these misalignments. We all have them, right? We live life with them. Our pelvis is hindi pantay. Our spine has, medyo misalignment. Our posture's going forward. We all have this stuff, and we just live our life. So if you are active, if you're going and doing these lateral movements for tennis, or you're sprinting, you're playing basketball, and if your spine is not in the ideal position, then you're prone to have injuries. Yeah, it's like a race car. If the race car is not in a proper alignment and it's racing, it's going to break down, right? So that's how our body is. If our pelvis is hindi pantay and we are constantly doing these sprints or this activity, we are prone to having back pain, maybe knee pain. Maybe the torn ACL is due to that unequal stress that you've had for so many years. So everything goes back to the spine and the pelvis. That is your frame. So oftentimes people come in because they have knee pain, and we don't even touch the knee. We don't need to touch the knee. The problem is usually because of the pelvis and the spine. So as we mobilize and as we improve that alignment of the pelvis and spine, the knee issues go away.
Okay. So, Doc, how about for those women who are already in the menopausal stage? How can chiropractic care help them?
Yeah, so of course, menopause, they're having some less estrogen being produced, so the hormones, of course, and then we have more stress as we age, we're going through all these issues. So chiropractic, again, by improving the function of particular nerves, we can help with that. We can help improve the communication to the organ. So we help alleviate that stress. So we help with the balance. Chiropractic is all about balance. So we improve that. We improve the sleep. We improve the hormone function. So we can usually help with anxiety and those hormonal imbalances.
Doc, should they go more often than us, like young adults, the seniors, or those who are already in the menopausal age?
Well, I mean, everybody's different. It depends on the state, the health of your spine. But some 30-year-olds have a very unhealthy spine compared to a 40-year-old. So it kind of depends. And that's what the first session, we identify the health of one's spine. And then we make that determination there. But yeah, oftentimes as we're older, there's more damage. Because see, as we age, our spine is degenerating, right? Like our spine degenerates, like our teeth. We develop decay in our spine. It's called osteoarthritis. And then advanced stage of arthritis is called spondylosis. So ultimately, as we age, our spine fuses together. Right? In between the vertebra is a disc, is a cartilage, and our joints move. But as we age, they deteriorate. Not all of them, but some of them. And that's why we get shorter. Okay? And then you notice as we get older, we get stiffer. Because as the joints degenerate, then they start to fuse. That's called spondylosis. So oftentimes when a person is over 50, I need to see them several times to get their joint moving again because it's fusing. So that's why, again, why we say to a 30-year-old, guys, take care of your spine now, and it's going to be healthier when you're 50. Like a dentist saying brush your teeth and floss, and you have less cavities, right? Chiropractic is the same.
So, Doc, it's safe to say that chiropractic care delays these degenerative diseases?
Yes, it slows the degenerative process, right? Because what's causing the degeneration is the misalignment, the lack of movement. Because if your joint subluxates, if it misaligns, it's not moving optimally, it's not then getting nutrients, so then it starts to wear down. Okay, and so by getting the regular adjustment, we can keep it lubricated and slow the aging. So that's why we tell people just do once a month. If you do once a month forever, you're going to have less back pain. You're going to have less arthritis as you age. You're going to possibly prevent sickness and disease. I mean, that's the beauty of chiropractic. It's all about wellness and prevention.
Doc, how about for our first-timers who are interested to go to your clinic or to try chiropractic care? What should they expect for the first time they will visit you or during the consultation?
Yeah, so really we get majority of our information through the history. Like I can, just by looking at somebody and their age, I can learn a lot just by seeing their posture. And then of course their symptoms, if they have numbness, tingling, or sciatica, or headaches, I'm learning all of that through the history. And then sometimes we might need to take an x-ray, so we might, do an x-ray, but most of the time we don't. We can learn about your spine when I do the palpation and when I do the adjustment. A healthy spine should move fairly easy. Like when I adjust all you guys, super easy because your spine is still fairly healthy. But then if I adjust a 50-year-old, it's much harder because the joints now have been stuck for so long. So, that first session is where we really learn about your spine, and then we give a recommendation of care. It's like, okay, this is where you're at. I need to see you a couple times a week to get your spine healthy again. And then after that, you just do once a month. That's the best way to do chiropractic. You spend a little time to fix it, and then you do once a month, and that's called maintenance. And you keep your spine healthy. Personally, I've been under chiropractic care for 30 years. I'm 50 years old, almost 51. Wow. So, chiropractic is a lifestyle. In my opinion, it's very important part of the lifestyle, healthy equation, because if you don't feel good, it's hard to exercise. Right?
And you don't look good.
So if you're not exercising, of course, well, that's you're not having a healthy lifestyle. So it's easy to, if you don't feel good, you don't exercise. If you don't feel good, you continue to eat poorly. So Chiropractic is that way to keep your spine and your body functioning optimally so you can continue to exercise, continue to eat good, and have a healthy lifestyle.
All right. Doc, going back to the topic about menopausal women, we all know that menopausal women are more prone to osteoporosis, arthritis. What can chiropractic do to those women who have hunchbacks already, who are fused, maybe their spine is fused? What should they expect after their first few chiropractic adjustments? Will it go back to the original straight spine? What should they expect for our treatments?
Yeah, okay, so you said a lot of things there. So we'll talk about osteoporosis first. So osteoporosis, that's so women after, when they're going through menopause, they're producing less estrogen. So therefore they are not able to absorb calcium. And so their bones become more brittle. That's osteoporosis. So chiropractic doesn't really help with osteoporosis. However, when somebody is osteoporotic, we still can take care of them. We use a different amount of force on each person, like with a baby and somebody, over 70, we use very little force. It doesn't require a lot of force. So very gentle spinal manipulation adjustments still can help somebody with osteoporosis. Now, then you also talked about hunching over. Once somebody's really hunched over, and they're like over 50, 70 years, 60 years old, no, we're not going to really change that at that point. But still, it's never too late. We still can improve quality of life. We can improve sleep, lessen the back pain, improve energy. Those types of things we still can improve. But once somebody is, say 70 years old and really hunched over, no, we can't change that.
But can we at least delay or stop the progression of the hunching?
It depends. If we still are able to adjust the joint and still move the joint, then yeah, that's when we can then confidently say, yes, we can kind of slow things. Yeah. But there's some cases where it's so fused, called spondylosis, and I can't even adjust the joint, then I would end up saying most likely that chiropractic can't help you. So it depends on the stage that their severity.
Doc, you told us earlier that it helps with stomach cramps, right?
Yeah.
Especially during menstruation. But is it safe for women who's currently menstruating to undergo chiropractic, or is it safer before menstrual cycle or after menstrual cycle?
Yeah, that's a good question. Because sometimes I'll hear like, "Oh, I didn't see you last week because I was on my period," and I'm like, it doesn't affect it all.
Really?
So first off, safe. Chiropractic is very safe if done properly. So absolutely, you can come while you're on your period. It's not going to affect anything. Like I said, it's not this violent thing. So yeah, it doesn't matter when you come as far as if you're on your period or not. Yeah, chiropractic is very safe and going to help with the menstrual.
Doc, how about stress and migraine relief? How helpful is chiropractic care for women?
Yeah, stress and migraine relief. So headaches, migraines, yes, chiropractic is very, very effective for those things. I can very confidently say majority of the time we have headaches, it's due to our posture. Okay, so I've spoken.
Headaches and posture.
Yeah, I've helped you, remember?
I forgot.
So what happens is, remember I've spoke about this before, for our proper posture, our neck should actually be curved like this. But the most common cause of headaches is we lose the natural curve, our neck straightens. That's called hypolordosis. So the weight of the head is on top of the spine, and that creates all that tension and the stress, and that's what usually causes the headaches. So by getting your alignment improved here in the cervical spine with these adjustments, specific adjustments, we help with headaches and migraines. Very effective, yes.
All right.
But Doc, for aftercare, what do you usually remind your patients when they go for chiropractic care?
So one of the great things we have when you join our clinics, our program, we have a stretching part of our program that's quite effective. It's a series of stretches where I basically have gone over and instruct you on how to properly stretch your spine so that you get the biggest improvement in your posture. And so that's something we recommend to do every day or every other day. So it's a 15-minute stretching routine that really helps getting the posture back in the neck, middle, lumbar, and the pelvis. So that's a very important part of the equation.
So can you give us some examples?
Yeah,
Something we can do.
So with stretching, first of all, stretching is quite boring, right? And that's why most people don't do it. It's so boring. Like, oh my gosh, I'm going to sit here for 10 minutes and do this. But the key with stretching is, of course, to do it But the second thing is you need to hold the stretch for at least 20 seconds for it to be effective. So if you're holding a stretch for 5 seconds, it's not really doing that much. Yeah.
Is it true though that we really have to feel that a little pain so that we know that we're really stretching it right?
I mean, you want to take the joint to end range, but I mean, it certainly shouldn't be like a lot of pain. Maybe just a little bit of, you feel that kind of tension. Yeah. So let's do like our cervical spine, right? So you're going to sit up nice and tall, okay? And so let's go. First of all, we're going to look to the right as far as we can. We're going to take a deep breath and exhale. And you're going to continue to look as far as you can to the right. And you're going to hold that actually for 30 seconds.
30 seconds.
So yeah, you're breathing. So you're kind of doing this breathing. And you're holding that end range for 30 seconds. Or 20. You can do 20 to 30 seconds. Okay, so let's say that's 30 seconds. And now you're going to go to the left. Continue to sit up nice and straight. Take a deep breath and exhale. Looking to the left as far as you can. Right? So we've done both rotation. Now we're going to come back to the middle. Remember, you're going to hold for at least 20 to 30 seconds. Now you're going to look up to the ceiling and you're going to extend, holding that position for 20 seconds.
I can feel the pain in my shoulder. Why is that?
Yeah. Okay, and then we're going to come back down to the center, and then you're going to go with the chin to the chest, holding for 20 seconds. Inhaling, exhaling.
Is it normal, Doc, that I feel something?
That's quite normal. Your spine, you're kind of just pulling it. Okay, we're going to come back to the center. And then the last one is we're going to do lateral flexion, touching your ear to your shoulder. So you don't raise your shoulder. Now you might feel stiffness because most likely you have some misalignments in your neck. So you can kind of feel that the joint is a little bit locked up. So it's kind of preventing the natural bend in your neck. You're going to come back to center. And then you're going to go to the other side. Now, one thing you can do, you can increase the tension. You can kind of put a little bit of pressure on your head, and you can kind of go over, like that.
This is much better.
You can increase that tension a little more. Yeah, so those are the cervical stretches, and so you hold that for 20 seconds each stretch. And so that's a good way to stretch your neck. And then we also do middle back, lumbar, and pelvis.
So this is the cervical part.
This is cervical, Your neck is called your cervical spine. There's 7 vertebrae there,
Doc, is it good to try it every day, to do it every day?
Well, stretching is very good. You can do it every day, but you don't want to try to pop your neck. You don't want to get into this mannerism of cracking.
We know someone who's popping his neck.
Doc, let's talk about
every single day.
Changing the topic.
Excuse me, let me cut you off. No, let's talk about let's stress about the importance of these stretches and of our habits. Because let's say we go to our chiropractors regularly every month, but we don't change our bad habits, we don't fix our posture, and we don't do these exercises. How important are these so we can maintain our spinal health while we go to our chiropractor?
Yeah, doing these outside things, having a good pillow, doing the stretching, these outside things, they help your spine during those off days. Because think about it, if you're only going once a month, that's 30 days of accumulative stress. So doing those things certainly continue to help. Just like eating properly and exercise, they make you healthier. These are healthy habits.
Doc, talking about pillow, for pregnant women, what is the best pillow to use, or where should we put it to be relaxed during pregnancy? Of course, when you have a big tummy. It's hard because you have to sleep like
sideways. Our number one pillow that I sell in my clinics is our side sleeping pillow. So we've created this pillow that really helps you sleep on your side. It's our number one seller. So of course, when you're pregnant, you are more tagilid. But also when you're pregnant, you can get a lumbar pillow, and that basically pushes your lumbar spine forward and reduces the pressure on the spine. So having a lumbar pillow while you sit in the car or at the office, that will also help.
Okay. Marami tayong natutunan mga kasambahay sa naging discussion natin ngayon, lalo na sa ating mga kababaihan. But this time, Doc, let's go to our social media questions. Question from Ems Domingo. Hi, Dr. Rob. Is it safe to undergo a chiropractic adjustment 1 month after giving birth?
1 month after giving birth.
Chiropractic
adjustment. Chiropractic care safe 1 month after giving birth. Absolutely. If you didn't have a surgery, again, if you had surgery, once you're up and and up and walking after a couple weeks, it would be safe. And if you didn't have surgery, yes, you can. As soon as you're up and walking, you could go back to the chiropractor.
All right. Here's another question, Doc, from Milet de Guzman. Doc, is it okay to undergo chiropractic care when having a period? Will it also help to relieve menstrual cramps or body pain? Thank you po sa advice.
Yes, chiropractic is very safe and very effective even if you're actually on your period. It's a very gentle spinal adjustment. And it's going to help regulate your hormone and reduce the stress on the nerves. So it really kind of brings that balance from within. So it helps reduce painful menses, cramping, and PMS.
Doc, another question pa from Maria Elaine. Good day po, Doc. Do chiropractic sessions may treat those who are having difficulty stretching their right arm and also experiencing a tingling sensation? Maraming salamat po sa kasagutan.
Okay, so whenever you're having numbness, tingling in your arm or leg, that's not good. That means that you have EPIT. The nerve is EPIT, right? You have a pinched nerve. So I don't know your age and I don't know who I'm talking to, so it's hard to say exactly what's causing that. It could be because of maybe there's arthritis in the joint, so the disc is wearing down, so the nerve opening is smaller, so the nerve is being pinched. Maybe there's a disc bulge. But however, whatever it is, yes, chiropractic is the most effective way to alleviate that stress on the nerve. Okay, so we're going to do these gentle adjustments in the spine, reducing the stress on the nerve, and then the body starts to heal, and then these symptoms, the numbness, tingling, goes away. So yes, chiropractic, very effective.
Thank you so much, Doc Rob. But for those patients, our kasambahays who wanted to try chiropractic sessions, where can they go to your clinics, Doc?
All right, so we currently have 6 locations. You can learn about our locations at my website at docrob.ph. That's docrob.ph. You can follow me on Instagram and Facebook, learn about chiropractic, exercise, nutrition. So yeah, we would love to meet you and kind of show you how chiropractic can really change your health for the long term. So come and see us.
Yes, but before we let you go, Doc Rob, we would like to congratulate you on your well-deserved award at the National Customer Choice Annual Awards.
Wow.
Doc Rob Walcher received the Outstanding Achievement in Chiropractic Wellness Award, and Doc Rob and Associates Chiropractic Wellness Clinic was named the Outstanding Chiropractic and Wellness Clinic. Congratulations, Doc.
Yeah, when Patricia and I came here 10 years ago, our goal was to, provide the best chiropractic service here in the country. And because of the demand, we've opened up 6 branches, and I have other doctors helping me. However, I'm still very active and adjusting in Quezon City. And it's something to be very proud of, to help so many people, and then of course to be recognized as a customer service. So that means that our hard work is paying off. We're really helping people, so it's great. Thank you.
Do you have anyone to shout out this morning?
Shout out to all my patients watching at home. Hello, and happy National Women's Month, and we love you guys, and thank you for all of your hard work.
All right, again, thank you so much, Dr. Rob Walcher.